Hi, everybody. Thanks so much for joining. We're so excited to convene people from across the country. We know that we have about 500 people that registered for this very important discussion. I'm here with an all-star panel of leaders that will engage in thinking through the impacts that this pandemic has had on vulnerable communities and across the nation, not just in California. My name is Sonia Diaz. I'm the founding director of UCLA's Latino Policy and Politics Initiative. The coronavirus has revealed the fractures in our society, especially our social safety net. And it's once again demonstrated that those who suffer the worst consequences are people living in poverty and communities of color. California data is in line with national statistics that are showing that Black Americans are dying at rates disproportionate to their share of the population. We still don't have full data tracking on infections, testing, and mortality. But what we know is that immigrants, people of color, and workers are disproportionately bearing the brunt of not only this deadly disease and pandemic, but the economic fallout. Research conducted by my organization and our partners, the UCLA Center for Neighborhood Knowledge, has found that Asian Americans and Latinos in Los Angeles County are overwhelmingly at high risk of unemployment and closures due to their outsized share in the retail and service sector. We also know that immigrant families, including mixed status families, are really out there in the cold because of the exclusion of benefits afforded to other Americans under the Federal CARES Act. But today we're going to focus on how to help and what comes next, what we've learned, and how we can maintain a focus on the needs of vulnerable communities. As California leads the nation in response and recovery efforts, what lessons can we export? And what can we do to ensure that we have equity and fairness for all here? We also need to think through what needs to happen right now during relief to protect vulnerable communities as we foresee a possible second wave of infections due to coronavirus, a wave that unfortunately will parallel our flu season. We want to know what role we all have, including those of you engaging on the webinar, as advocates, as funders, as staffers, as elected officials, and as neighbors and family members, in ensuring that we uplift our vulnerable communities. And finally, how can we redefine what an essential worker is in this economy? It's no coincidence that this panel and this webinar features all women of color, to be frank. As essential workers, women have been on the front lines of this crisis. And in our leadership here in California, allow me to quickly introduce our panelists. California State Controller Betty Yee, thanks so much for joining us. Assemblymember Lorena Gonzalez, who is also chair of the Latino Legislative Caucus here in California. I know that Assemblymember Wendy Carrillo will be joining us shortly. Dr. Carmen Rojas, the incoming CEO and president of the Marguerite Casey Foundation. Thanks so much for coming and being part of this important discussion today. Just to kick us off, in your opinion, what has the COVID-19 pandemic revealed about racial and health inequities in this country? I know that's a big one.
Everything. I mean, from our perspective, I feel like this has been a real reckoning for people who didn't believe that there were racial disparities in access to quality healthcare, access to quality housing, access to quality jobs. This moment has created an opportunity for all of us in this country to really see the ways that systemic racism has excluded people of color, immigrants, Black people from sort of the infrastructure that should have benefited us all. I think it has revealed sort of our weakness, like the tenuous ties between the infrastructure that we talk so much about in the story of the United States, that we are sort of the first most robust economy in the world, that we offer sort of all of our people access to mobility and opportunity. It's really demonstrated the tenuous ties of that. And then lastly, it's really brought to the forefront the ways in which our social safety net has left so many people behind, that it's not a safety net, but instead it's like it's a safety blanket with a bunch of holes in it, and people have been falling through those holes for the last 50 years. And the need really to invest and reimagine what our future looks like together, as opposed to going back to a past that left so many of us behind.
That's really interesting. Really reimagining is the call to action here. Hi, Assemblymember Wendy Carrillo. We just got started. We're so excited to have you here on the webinar with a panel of all women of color. The first question just for everybody is, what has coronavirus revealed about, systemic racism, the structural discrimination that exists in this country, and what are we seeing? And I know you represent Los Angeles County. Assemblymember Lorena Gonzalez represents San Diego. She's right next to the border. And then Controller Betty Yee, the whole state. But what are you all seeing from your perspective? What has this made clear?
I think what it really makes clear, and what we're really seeing, is the manifestation of just a long time downward spiral of disinvestment in many of our low-income and poor communities. And when you think about where we're seeing the concentrations of cases, where we're seeing some of the heaviest impacts, and no surprise, where we're seeing, frankly, the communities that are really suffering from the greatest economic displacement today, they're in communities of color and low-income communities. And so, when I think about, just how we move forward from that, this really is a time where there are no more corners to turn to, really try to mask what we've been dealing with. Everyone is equally affected in terms of the virus not really understanding, color and income status. And so there's kind of this sense of awareness, I hope, that's widespread, that we really are dependent on one another. And when you talk about public health, which is really kind of the foundation of all healthcare, I mean, that means public health, the entire public. And so I'm hopeful that when we look and understand that it's no surprise, really, that poor communities are bearing the brunt of this, communities of color, we've not invested in those communities, people with chronic health conditions, who can't afford healthcare, people living in areas where there are just poor air quality, are having severe, difficulties with the virus. And so on one level, it's not surprising. On the other level, when we look at just how it's manifesting itself and the impacts that it's having, I hope that this is really the great eye-opener that is going to cause us to finally act on addressing a lot of the institutional racism and disparities that we're living with that Dr. Rojas has talked about.
I want to add to that. When we talk about the effect of this pandemic on different aspects of the community, the health aspect, right? Those who are more likely to be hospitalized or end up in critical care or dead, have pre-existing conditions, things like asthma and diabetes. Well, that happens to coincide with communities of color. They live in areas where environmental justice issues have created an atmosphere by which we're less healthy to start with, and that is making them more vulnerable in this situation. And then you talk about unemployment, and you look at least for the numbers were released yesterday for San Diego, and every community that's suffering the highest levels of unemployment are also my communities, the communities that are working class. They're service sector communities. They serve the tourism industry in San Diego, and they're out of work. They serve the restaurants, the hotels. So we have about well over 25% unemployment in my district right now. The highest level is all San Diego County is where Black and brown people live. When you talk about essential workers, when you talk about essential workers who aren't doctors, whether you're talking about our farm workers who are picking our food, our warehouse workers, the workers who are delivering our food, if you talk about nurses and nurse assistants and people who are providing kind of the frontline care, so many of those jobs are being held by people of color. The transit jobs, of course, and we're seeing this across the country, our transit jobs are disproportionately held by African Americans, and some of those other jobs are disproportionately held by Latinos. And so you have these essential workers who have to go out and work without necessarily the PPE that is afforded to some of our more heroic essential workers and are exposing themselves, are more at risk of getting it. So in every line, we're seeing where this is affected. And then you have on top of that, a community like mine, which has a huge number of mixed status households, a federal government that has penalized not just individuals who are paying taxes and working and paying taxes through an I-10, not allowing them to get unemployment insurance, not allowing them to get a federal stimulus, but actually saying if you're a US citizen and married to somebody who's undocumented, that you also don't get a stimulus. So with so many mixed status households, it's almost as if every line of this pandemic and every negative effect it has disproportionately affected a community like mine. And yet we're not the ones who are at the beach calling for opening up and saying public health orders don't matter. So I think that's an interesting juxtaposition as well. It's people who realize how serious this is, who are being disproportionately affected at every level, and who take the public health orders really seriously.
That's a really important frame, that it affects everybody. As Controller Yee said, this is an idea and an opportunity to reimagine. And unfortunately, the imagination right now doesn't seem to be so big, as Assemblymember Gonzalez said, in that we're penalizing those that need our help the most. Assemblymember Carrillo, what are you seeing?
Well, I would agree with the points that the controller and the assembly member have already touched upon, and would add that there is a real cognitive dissonance between those that are impacted the most versus those that get to stay at home. And even in conversations with friends, I can share that there is a real impact of our mental health and what it means to stay at home, what it means to be a working parent, having to do social distance learning from home, as well as to continue to do your job. My colleague in the assembly can attest to that. But I think there's a real disconnect that has always been at the frame if you study and know about communities that are impacted and are the most vulnerable. This is not a new conversation. There's nothing new about it. It's just at the surface now. And to me, it's surprising and yet not surprising, the disconnect. That we are 100% okay as a society. I certainly am not, and I know that my colleagues aren't, in continuing to disenfranchise farm workers who ensure that because of their work and their risk, we continue to have groceries in the grocery store. My father is in custodial services, and the streets are clean because of him. He's an essential worker and he's 61. My mother is a home care worker. She's 61, and she takes care of a 92-year-old woman who would otherwise be on her own. They were not at the front line of receiving any kind of PPE. And so there's this real big disconnect. And you want to go to the store and buy food, and yet don't think about the workers that are exposing themselves every day. We're not just talking about nurses and doctors and hospital workers. We're talking about folks that are ensuring our economy moves forward. And yet there's like this blind that goes up, and like this refusal to acknowledge that they are risking their health when they go back home to their families. And so I think that cognitive dissonance is very real. And I think when we return to the legislature on Monday and we begin to have conversations about the budget, it's one thing to really talk about, wanting to put communities first. But then there's an issue of where our values fall. And our values are going to fall within the budget, and how we appropriate funds to make sure that those communities that are have been ignored for far too long, that we have an opportunity to create new systems across the board, which are able to identify I-10 taxpayers to make sure that they receive unemployment insurance, to make sure that even the federal conversation about reducing pay for farm workers is not a stance that California takes, to ensuring that our most vulnerable and disenfranchised essential workers actually have the resources that they need, and that we continue to move this economy forward. This is a new opportunity for us to start fresh. And those are, I think, the conversations that are critical that we should be having.
Thank you so much, Assemblymember Carrillo, for all of that. I want to remind the audience, we'll take your questions. Go ahead and type them into the chat box, and we'll take them on a rolling basis. So please engage with us. Assemblymember, you provided the perfect segue to the next question, which is about money. It's about fiscal appropriations. And California, notably, has been in a different financial state than when we were all suffering from the Great Recession. And we had and/or have a sizable rainy day fund. But in real terms, I want to ask Controller Yee, and then I would love, any support from Assemblymember Gonzalez, who is the first Latina to ever head the Assembly's Appropriations Committee. Where California's money is being allocated during the pandemic, and what are the challenges that lay ahead as the pool of funding is depleted? Before we started this, we talked about how this is a real opportunity. It's an opportunity to reimagine. We've unfortunately seen small imaginations at the federal level, if I might say so. But how do we reimagine? How do we appropriate? How do we deal with the horrific pandemic that is occurring, given all that we know to be true?
Yeah, that's a great question, Sonia. So first of all, let me just say California, and I have to give a shout out to my two colleagues and who just have exercised such tremendous discipline fiscally, because California really, at the start of this pandemic, was in very, very strong fiscal condition and historic reserves. We really have been paying down debt over the last period of years. And so we really had an economy that had been booming for almost 10 straight years. We just had our first downturn in terms of unemployment in the month of March, preceding the pandemic, because we were looking at a mild recession approaching. So when you look at California's fiscal condition, as a controller that pays the bills for California, I couldn't have been happier. And I still think that we actually are on pretty solid footing. Now, a lot of it, the numbers will bear out when we look at the fact that unemployment claims have now surpassed the number of jobs we added to the economy after the Great Recession. So we will see those numbers bear out in the coming months. In April, we collected 26% of revenues that we were anticipating in the governor's budget from income taxes, because we pushed out the deadline. So this is what we're looking at going forward. Here's what I would say. So we have a rainy day fund that the voters approved very wisely. It became a very good budgeting tool that allowed for a lot of prudence and discipline in spending, because we do have a volatile tax system. The legislature saw fit to retool that rainy day fund. So they added a reserve for education for our safety net programs, and we now have our budgetary reserve as part of the rainy day fund. Where most of the spending for COVID-19 has taken place has been from that budgetary reserve, the special fund for economic uncertainties. And essentially, the legislature, before it recessed with the pandemic and exercising distancing, authorized $1 billion and other expenditures for the governor to respond to COVID-19. And I will say, as the state controller's office, we consider ourselves the fiscal first responders. We're still issuing payroll, we're paying vendors, we're paying school districts, we're paying local governments, and so that doesn't stop. And all of those entities are really kind of a front line of sorts as well. So we're doing our job. So going forward, here's what I would say. California is not going to be able to weather this on our own. And frankly, we ought not let the federal government off the hook. What we're going to need to see, really, from state to state, and already the Congressional Budget Office is anticipating that the budget shortfalls are going to be pretty devastating across all of the United States. So given that, what do we need to do? And I think it's going to have to be a combination of what Assemblymember Carrillo just talked about. We have to make those investments in the budget that ensures that our most vulnerable populations are healthy and safe. We need to be sure that as we're trying to rebuild this economy, that we continue to have real-time financial relief that the federal government hopefully will continue to provide and elevate. We need to start making investments so that when we look at the economy of the future, that we are hopefully addressing this vulnerability that we saw in terms of, just what was really undergirding this economy, the vulnerability of the workers in the service sectors, and the jobs that we grew after the Great Recession. I hope we start to unveil, the quality of those jobs. They weren't exactly the self-sustaining, living wage jobs. And so, I think this is really kind of just pull the curtain back with respect to what we need to do going forward. And so it will take a combination of smart value setting, prioritizing in terms of state budget funding, definitely continue to hit the federal government with respect to real financial relief, and then looking a little long term in terms of how we're going to rebuild this economy. And I'm going to just say this because we don't talk about this. We hear every day from our governor about how we're keeping Californians healthy and safe. And that is definitely the first priority. But when I think about our public health infrastructure and what's lacking, particularly in our low-income communities and our communities of color, our remote communities, this is an opportunity to build that infrastructure for the next crisis. This is not going to be the last crisis that California faces. And in fact, there are a lot of people around the world and even here in the United States and California really tagging the climate crisis and all of its manifestations as the next crisis and probably more widespread impacts that we're going to see. So we have an opportunity to look at how we rebuild the economy by making those investments in our low-income communities, our poor communities, our communities of color, to really build out that public health infrastructure and footprint that will be so helpful when we experience the climate crisis impacts.
Thank you, Controller Yee. Assemblymember Gonzalez, what are you seeing? I mean, I'm hearing investments. I like that. Tell me more.
Well, first, I think you have to give credit where credit is due. After many years of cursing him, I will thank Governor Jerry Brown for guiding us into this $20 billion rainy day fund. I mean, we supported it, but every year we did kind of press him to do some one-time spending on a variety of issues that were pet issues for all of us. Important issues. I don't want to downplay what we've done and the investments we've made. But it, you know, we're really in a great position because of his leadership, a much better position at least than we would have been. You know, I think there are some things that have come up, and this is why I'm so excited to get back to work on Monday in the Capitol. We've been working at home, but there's some things that come up. We gave, you know, the governor a blank check and walked away from it and got to hear how he's spending it as he spends it. And one of the things he has invested in is apparently contracts for PPE. We're excited to see if this works out. But one of my questions were, why couldn't we have that kind of investment here in California making PPE? Why are we going halfway around the world, contributing greenhouse gas emissions when we talk about bringing in, you know, things that should be able to be manufactured right here? Is that a legacy that we want? Is there some other way? We also talked about purchasing power. I mean, one of the reasons he did this is because California as a kind of nation state does have purchasing power. We're so large. Well, how are we using that purchasing power in California for the benefit of Californians? And so that's something that I really hope we as a legislature and the governor really looks at. You know, when we look at the massive amounts of contracts the state of California has and lets out every year, what kind of demands are we making on the companies that we utilize and really enrich through our contracts? And that's something we worked on in the past. You know, do we and we I'll give you a spoiler, we don't. All these great laws we pass and all these insistences we have about healthcare and living wage and paid family leave and making sure every worker has a contribution to unemployment insurance, all of these laws that we've passed, we don't even consider when we're making contracts. I think that's something that we can do to ensure that the purchasing power that we're utilizing in the future is one which gives back to working Californians so often in those service sector jobs. We have to talk about jobs. You know, I really think one of the big fights is going to be, it's not just investments, but what do we give up? We have made so much progress. And we were on the road to making more practical progress of lifting up really low wage workers with the expansion of the minimum wage, of course, of keeping covered California despite everything that's going on in the federal government, of expanding overtime for farm workers. But so many of those expansions are dependent on, they all have kind of off-ramps, right? We built in these off-ramps in case things didn't go well. Well, things aren't going well. Well, let's have a real discussion if we want to stall what would be economic recovery because things are going bad. Because what I don't want to see in times that are worse than the recession, those of us who represent working class communities know the recession, coming out of the recession was great for Silicon Valley. It was great for investors. It was great for Wall Street. It wasn't so great for my neighbors. And so we can't, again, repeat those types of policies that take away people's retirement security, that take away people's healthcare or living wage, that take away the foundation of what we were starting to build. And so I think that's going to be one of our bigger fights. And it's not necessarily a direct expenditure. And then, of course, what my colleague Assemblymember Carrillo said, and something that the two of us as members of the Latino caucus are really focused on, is how do we ensure that we're not leaving behind an undocumented population, I-10 filers, people who are paying taxes but yet have no safety net during these times. And that's incredible if you think about it. Some of yesterday, I think the governor's announcement on giving a debit card basically for kids who qualify for free lunch, they're going to get some additional cash for food. Stuff like that is very creative and very good, because what we know in communities like ours is it's not the undocumented kind of off on their own. We have so many mixed status households where every member of the house may have a different document status, but we know that a lot of those, if not most of those children, are actually US citizens and people that we should be investing in the same way we invest in every other US citizen, California.
That's right. And thanks for that. I'm going to take some questions from the audience and fold them in. We have something from Connie Calderon Jensen and my colleague at UCLA, Dr. Michael Rodriguez, really thinking through essential workers. Dr. Rojas, before you go to the foundation up in Seattle, you started the Workers Lab. And Assemblymember Carrillo, you did a lot of work amplifying the voices and the needs of workers, and you're doing that now too. Can you talk about essential workers, what you're seeing, both in terms of them not being able to shelter in place, what their family composition means, and what a future where we are creative in our imagination would look like for those families?
Yeah, so yeah, for us, the thing that's been the opportunity that we're trying to seize as a foundation and what the team at the Workers Lab is really trying to, and has been trying to do since its founding, is to expose that all workers are essential and that we should actually move away from this national narrative or acceptance of the working poor as something that we accept, and instead actually offer a floor for all workers that is livable with benefits and care. This has really, I think, exposed all of the ways in which the people that keep our economy going, and that frankly have kept our economy going for the last 50 years, have been invisible to those, to white collar workers, to a number of our elected officials. If you are a service worker, if you're a teacher, if you're a nurse, if you're a home health care worker, there's a way in which these sets of workers have been invisible. And this moment has created an opportunity to shine a light not only on their experience as unique, but the critical role that they play in moving our economy forward. So for us as a foundation, we're trying to find ways to support them. I know there's a conversation around AB5 that's really interesting. So for us, one of the things that we did initially, knowing that gig workers and contract workers have been left behind in our social safety net and oftentimes are misclassified by corporations that are making billions of dollars on their backs, we seeded a fund at Workers Lab to get them emergency cash if they needed it. And I think that this is an opportunity for us to revisit these, I hate to put it this way, but like the innovative interventions that have been introduced into our economy that frankly fall on the backs of poor people, of people of color, and of immigrants as a way to solve for a greater concentration of wealth in the hands of a few people, to show that misclassification is actually a real problem. And it's a real problem not because it's inconvenient, it's a real problem because then people are really left behind. And we have an opportunity here to really demonstrate, on the one side, the type of social safety net we want for working people, but on the other side, the ways that a set of investors and corporations have put into place these systems that put profit over people, and we as a state have an opportunity to take that story back and put people before profit.
Mm-hmm. Thanks for that. Assemblymember?
I want to bring a little bit of a personal element to this. So I'm the eldest daughter of 5 girls. Small home in Boyle Heights, City Terrace, in the district that I represent. Hey, and I want to talk about jobs and families through a child's perspective, because I think education equity plays a huge role in the conversation that we're having right now. And so I think of a movie that I grew up watching, like Stand and Deliver or La Bamba. And what you saw in the family dynamic of that Latino household was kids doing homework in the bathroom, kids doing homework like at this small amount of this window where they had like an hour of free time. You know, Richie doing, you know, his homework like in the back of the camper where, you know, after he was picking fruits in the Central Valley, or in East LA where like the young 16-year-old sophomore is also taking care of her younger siblings. That hasn't changed. That was in the 80s. Those movies are from the 80s, but that dynamic hasn't changed. And so you think about if you are fortunate enough to have both of your parents at home, and your parents have lost their jobs because, at least in the city of LA, 49% of people are currently unemployed. And you live in a small little home in a disadvantaged community. You don't have Wi-Fi. You don't have a laptop. You don't have connections. Even maybe you have a smartphone, maybe you're on some kind of service, but how in the world are you doing your homework? And how are you trying to help your parents pay the rent? Here in my community, I know kids that are sewing masks and selling them in the corners just to make ends meet. LA Unified, the Los Angeles Unified School District, the largest in the state, has fed since the pandemic started millions and millions of children. And the food shortages, the lack of money, food pantry is running low. This is a reality for a lot of people. May 1st is coming around the corner. People don't have money to pay their rent. And if you own a property where you have tenants and you have a mortgage, you're also not going to be able to pay your mortgage if you depend on your tenants' rents. Like this, these are very real bread and butter issues that are affecting our community daily. And I bring up the perspective from the movies because we've seen it. And maybe we haven't seen it in our own community, or we're not experiencing. It doesn't mean that it's not happening. And I worry about this generation of students. We know the statistics say that if you are not reading by 3rd grade reading levels, we've lost you to a system, and you may as well be on a school to prison pipeline. That's real. So what's happening with all these young kids that aren't learning how to read right now? Because parents are trying to work, there's not enough support, they don't have a laptop, they don't have Wi-Fi. And so it's these are the things that I think a lot of us think about because it's kind of missing from the larger conversation. And sometimes we feel good in saying, oh, X company is going to deliver Chromebooks and they're going to go. What's the point if you don't have Wi-Fi? What's the point if you don't have someone that's going to help you achieve the level that you need to achieve? And so the gap is only getting bigger. Communities that are being disenfranchised are only growing larger. I want to come back to my colleague, Assemblymember Gonzalez, who brought up the ITIN workers. In fact, in California alone, there are 1.2 million ITIN taxpayers who contribute $3.2 billion to California's coffers. And I am not okay with robbing people of their money. And I think we're at a point where it's like, are you as a Californian okay with taking someone's money and ensuring that because of their work, you are able to receive unemployment benefits? I am not okay with that. And those are the values that I think we need to revisit.
So there's some values and there's some policy responses that are here. We're getting a lot of questions from the audience around college students and students. And there's been some good coverage in the media about care and household formation and who, again, is taking care of elders or young people, how some school districts are better equipped to transition during this pandemic and others aren't. And so I just want to bring to light 2 things. One, basic internet access. Utility or not, opportunity to think through how we regulate that so that we can level the playing field. And then 2, to the extent that we think about how to keep people safe right now, I go back to Controller Yee and these investments, and then go back to all of you about how there are not the same worker protections. So if you have to be a teacher at home and care for other people, then one should still have the support and the benefits to stay home and stay safe, because the most important thing is that we should not have an unnecessary loss of life. Would love any responses or reactions to that.
Maybe I'll start because it's a great question, and I will say I think fundamentally when I think about where we go from here, and I really want to thank Assemblymember Carrillo for kind of level setting with respect to what the reality still is on the ground for so many families, and I think it's very easy for any of us to become so insulated from that. It's, I mean, we have a job to do in terms of directing dollars, but we have to do it in an informed way. And frankly, I think the way out of this pandemic is going to be through workers. I mean, this recession was accelerated because of the pandemic, and we're going to recover out of this pandemic by putting people back to work. And so when you think about what's the infrastructure we have to build to ensure that one, we're going to create an economy that is going to address all the vulnerabilities we've just been talking about since we started this webinar, that we're not going to repeat the mistakes of the past, that the investments we make are truly that investments. And that, by the way, I talked about keeping the federal government on the hook. I want the private sector to play an equal and important role. We know that the private sector is a diverse, I mean, it's made up of diverse businesses, and we really appreciate all the assistance that many of the companies have been providing, but these are not sustained long-term investments that are going to create capacity in communities. And that's what we really need. And so I'm excited to get back into a conversation about when we talk about investments. And it's a tricky time to talk about investments because we've got budget shortfalls, but this is actually the best time to talk about investments. It's about rebuilding and about the fact that we got to do both at the same time. And so there's no choice. So I'm excited about the conversation to come. And in terms of broadband and access to the internet, so basic. It should be utility. And it affects every aspect of our lives now, and in fact is a contributor to inequality if you think about every aspect of life that it touches. Lack of it, whether you're in a remote area, just in a challenged area, from education to public safety to access to information, access to job opportunities. I mean, you name it, it is so embedded in kind of that, the way that we are transacting business and carrying on our lives today.
Thanks for that. We have a question from the audience about our immigrant population that are in detention. And Assemblymember Gonzalez, I know you authored a letter on that. Can you talk about what are the most critical steps during this pandemic for that population?
You know, this is probably one of the most frustrating things for me as a state legislator, and a state legislator who prides myself on like getting my hands dirty and forcing change. Because the reality is, no matter how many times we pass laws or give direction in state government, this is something that's controlled by ICE and the federal government. So, you know, we've voted to ban private prisons. We've voted to have our local officials go in and check them, and none of that is happening because we really can't. So number one, it's frustrating from a state legislative perspective. I'm really grateful for all the journalists who have been following this. What we know is in my district, in fact, the biggest hotspot for COVID-19 positive cases is coming from the Otay detention facility. It's been massively spread. And the information we were getting from the detainees themselves through family members and lawyers, where they didn't have adequate PPE, they didn't have adequate social distancing, they didn't even have adequate soap. But when we tried to go down and present them with masks to donate, we tried to present them with money for their commissary to buy soap for the entire facility, they said, no, we have enough. We don't need yours. And sure enough, now they might have actually delivered some. But ICE's cruelty on taking refugees and asylum seekers and people who presented themselves at the border legally and locking them up and exposing them in mass amounts to the coronavirus is, I think, a cruelty that we've never quite seen before to the level. So we're fighting. I'm very grateful for the ACLU who has intervened with lawsuits. It's, I think, our best attempt to release some of those detainees who clearly have no criminal background, who have family. A lot of people don't realize that most of those folks were en route to going somewhere. They have family, they have sponsors, they have neighbors who are here and who will help care for them. But locking them up into what is a virus hotbed is, it just, I think, shows the total disregard we have, or we don't have, obviously, but this administration has shown towards immigrants in general, but these immigrants in particular. And so it's been heartbreaking. We're still pushing, but as much as I think I've had I don't know, dozens of emails proposing legislative solutions. I don't mean to be what we say in my office is no se puede about something, but look, we've tried. We can keep doing this, and we will, and we'll keep encouraging people to get involved. But the reality is we really need to put the pressure on the federal government, to put pressures through the courts to release these detainees who do not deserve to be at this point detained.
This is helpful. I'm gonna switch gears because speaking of the federal government, in the first CARES Act, which was trillions of dollars, we saw some people explicitly left out. We also saw some help for small businesses, quote unquote, small businesses. So we have a question from the audience about Latino entrepreneurs and small business owners who are struggling to tap into that paycheck relief program. And this is also thinking through policy formation. You know, first in time is not fair. So what are some of the ways that we can support small businesses? We know that at least in minority communities, these are not only means for families, but also workers, but they are community anchors. And so as we see kind of changes in our communities because of rising income inequality, these are the things that we need to not see go away during this looming recession. So would love to hear from Assemblymember Carrillo, and Dr. Rojas, what are you seeing? What are you hearing from both your constituents and then Dr. Rojas from entrepreneurs?
So I recently had a really great conversation, very similar to this, with Maria Salinas, who is the LA Area Chamber of Commerce president and CEO. And the concerns were the same, is that if you are a more established, more knowledgeable small business, you may know where to get resources, where to go, who to talk to, how to connect with elected offices to help you guide you through the process. But if you are a minority-owned, women-owned, immigrant-owned, ITIN taxpayer-owned small business, you may not have the same resources, or you may not know exactly where to go, and it is incredibly confusing. The amount of calls that my office received when the first CARES Act came out in terms of which bank to go to, what if you're at a credit union, what are some of the stipulations, it wasn't easy. And you can try to do all the process, and then at the end you don't qualify. One small business mentioned to us that they actually did qualify small, and I think I want to talk about it through the perspective of restaurants, because restaurants, I think, are what defines a community. And I know in my district specifically, there are so many incredible mom and pop owned restaurants, and one in particular in Eagle Rock, Columbo's. They actually were able to receive, but because of the stipulations to have to pay a percentage of your workforce, even though the workforce isn't there, they actually couldn't receive any of that additional help from the stimulus. And so the stipulations for small businesses to actually be able to receive funding and support need to change. And we need to ensure that our members of Congress, and I'm lucky that we live in a very democratically safe district where I know our members are pushing and moving forward, but that needs to be across the board. And I would even argue that when it comes to restaurants, we need a very small restaurant specific relief effort across the country and really in the state of California. So that would be my first segue into that. And I would say that regardless of the type of business that you have, where it's located, legal status of mixed families that own a small business, contact your local chamber of commerce. They are a resource to you. It's why they're there. And they have various different folks that can actually help you, guide you through different languages so that they can connect you with a small business administration, folks here in California and across the country that are doing this type of work.
Thanks for that. Dr. Rojas?
Yeah, I mean, the numbers came out yesterday on the payment protection program, and like 90% of Black and Latinx owned businesses have been left behind, right? So there's just that fact. And that for me is a signal that we can no longer make policy that is race neutral in a context where race has informed who has access to money, who has access to quality jobs, who has access to public benefit, that we need to be very clear about who we want to come forward in the rebuilding of our economy. The second thing that I've been thinking a lot about is there's those who have been left behind and those who have been benefiting, and in particular the set of investors who are asking us as the public to assume the risk that they have assumed as investors into their companies, into their startups, by using the payment protection program as a way to supplement the incomes of their startups. The fact that that is another way that we are enabling private equity firms, hedge funds, venture capitalists to continue to control the conversation about the concentration of capital in our country, and not being very specific. I think broadly, when I think about reimagining our economy, I think we have to really be clear about the public good and where our public dollars and our public leaders are enabling a conversation about our economy that includes everybody and doesn't concentrate wealth. The internet example is one clear example, but I can imagine 100 in the state of California. Housing as a public good, the internet as a public good, you can have quality education as a public good, that we have now seen what it means to privatize major functions of the state, and it doesn't work, and especially doesn't work for Black communities, for Latinx communities, for immigrant communities, for undocumented communities. Like there are clear losers in this setup when we work to make sure that government is unaccountable to us. I will say, as somebody who's stepping into a role leading national foundations, the nonprofit sector is the third largest industry in our country. It has surpassed manufacturing. Those are people in communities, in all of your communities. We fund in San Diego, we fund in Los Angeles, we fund California as one of the biggest places that we do grant making. Those organizations are keeping their doors open, providing immigration support to people, providing healthcare support to people, thinking about the way this sector is actually really transforming the conversation, but also not putting them in a place to supplement or to take the place of government, but being able to open the door to the future that we think is possible is something that's front of mind for me when I think about things like the PPP.
So this is really helpful. One of the things that's clear is that this year was going to be a lot. We have the census, and a report from my colleague, Dr. Paul Ong at UCLA, just identified how our response rates are really not mirroring those from 2010, even though we have more people and we went digital. That said, we're dealing with a pandemic. We also have an election where states are controlling the means to cast a meaningful ballot. And in some states like Wisconsin, it means life or death. So can we talk about going into an election year? What can the rest of the country kind of know about leading and protecting vulnerable communities? What are some of the leadership strengths that we need to be lifting up right now? And what's the call? I'm getting a lot of questions from the audience. I'm a physician. How can I help? How do we help our homeless folks and low-income folks that don't file taxes because their income is so low get some benefits? How do we help Indigenous communities? How do we help college students, right? Because the CARES Act, if you were over the age of 16 and still classified as a dependent, no money for you. So what's the leadership here? What's the call for all of us?
Let me start, because I think, Dr. Rojas, you mentioned something that I think is really critical, and that is, I think about our nonprofit sector as something that really is a safety net of sorts, because it does actually fill in a lot of gaps that, frankly, government falls short from really trying to provide. And so when I think about the nonprofit sector, that to me has been kind of a key sector in terms of the connection with so many of our vulnerable communities. And I can just tell you, within the API community, and we have a great program, thanks to both my colleagues in the legislature, both Assemblywomen who were great supporters of the California version of the Earned Income Tax Credit. We have money on the table that we are ready to give back to working class households, and we've extended the deadline. But we used to have our nonprofit partners on the ground, really helping to identify who these families are, who these households are. We have the ability of volunteers to help them file their tax returns. And so that infrastructure has been compromised with, obviously, the directives under this pandemic. But looking at creative ways of how we can bring some of that back so that we can be sure that we're putting dollars into the pockets of those who, frankly, have earned it through work. Secondly, I would say, we've talked about an election, we talk about census, probably not top of mind issues for people right now, but they really have to get elevated to be top of mind issues. This will not go away. In fact, I think these are two very specific things that can be co-opted away from us with respect to how we just start seeing a lot of abuse and fraud and misinformation in terms of what voting means this year, how the difficulty of even thinking about an election will just dissuade the interest in terms of an election this year. Being counted, so fundamental in terms of dollars coming to our communities and dollars to our state, our representation, to be able to have Assemblymember Carrillo and Assemblymember Gonzalez represent the communities that they do. It's only possible because we know what the character of those districts are. So these do not get short shrift. And I think if there's a call with respect to how we deal with this, I'm going to go back to you, Dr. Rojas. I love the word reimagining. I have said for a long time we need to reimagine work in this society and in this economy. And we've got the talent, we've got the brain trust, and I think all that's kind of in front of us are just kind of these barriers that people keep putting in front of us. But we know what the realities are, and if we're guided by the realities and the experiences on the ground, I think there's no stoppage of how we can be innovative in terms of certainly getting dollars back into the pockets of working people.
I want to add to that too, because I like the Reimagine work, and this is something that obviously I've spent my whole life working on. But this pandemic has taught us about, I guess, when we talk about essential workers, when we talk about certain things that are missing, and I'll take one thing that we were working on, and I hope doesn't get lost after this, childcare, right? When have we ever been more aware of the value and need for childcare? And I think those of us who are working moms in particular, no offense to the dads, but sometimes the burdens are a little different. We realize, hey, the economy cannot work unless there is somebody available to take care of my child, whether that's going to school, after school programs, or a traditional childcare for younger children as well. These are essential to not only my personal life, they're essential for our economy to work. But we have never invested into those workers the type of salaries and benefits that we would give to somebody else that was essential. And last year when we were working on the right to childcare workers' right to organize bill, which I thought was one of the most profound and important bills that we passed last year, kind of under the radar, but for those of us who had worked on it for years, it was essential to kind of growing this respect in an industry that we know is predominantly women of color in particular, and can't be outsourced. It can't be, you can't be replaced by a robot. This is going to be around for a while, and we're always going to need childcare providers. How do we invest in ensuring that they're trained, that they're protected, that they have the resources necessary and the income necessary, the health care necessary to continue as we move forward? I often compare it to construction. And having been a former labor leader, I love the construction industry, right? 100 and some years ago, some guys got around and said, this is dangerous, it's important. We're gonna make sure that there's training, we're gonna make sure there's prevailing wage, we're gonna make sure that there's healthcare and benefits, and we're gonna strengthen the union in these sectors, and we're gonna create a standard for this male-dominated profession that maybe you don't need to go to college for, but is important and can provide a good middle-class career. Now, sometimes that kind of goes down, and we need to always protect that sector. I think it's really important because there are always attacks on that. But why can't we do that for jobs like childcare and teaching assistants and women-dominated fields and people of color-dominated fields that we now see are being essential? So when we think about reimagining and coming out of this, not to say that one person's job is more important than the other, but where do we find, especially in this essential workforce, whether it's farm workers or childcare providers, whether it's grocery store clerks, like how do we, as a society, whether you're a physician or a lawyer or whatever background you have, how do we get out of the habit of thinking that one job is less worthy of another, right? If somebody is willing to work 40, 50, or 60 hours a week, that job should bring in enough that they can have a roof over their head, they can feed their kids, they can send them off to college possibly, that they can get by with that a lot without an earned income tax credit. I mean, I'm going to support an earned income tax credit every time it comes up, but we shouldn't need it. And instead, I think what we've kind of faced in California is this weird dichotomy where we're so enamored with like the tech industry. It's great, it's California, it's Silicon Valley. Well, in reality, we need to be a little honest with ourselves. We have a a huge tech industry that, you know, I'm proud of. I went to school up in the Bay Area. I think that this is, a lot of my colleagues went into that industry. They also are part of the reason why our unemployment insurance is about to go under and we're going to have to borrow from the federal government, because there are hundreds of thousands of gig workers whose employers who are sitting on billions of dollars never paid into unemployment insurance for them. That's right. They're part of the reason that we're fighting to have some sort of healthcare or paid family leave or sick day policy for workers who are misclassified as independent contractors. You know, we have asked people to shoulder the burden, and then we think some jobs are super cool, and so we haven't asked or demanded that they shoulder the same burden. And I hope we come out of it as a society asking those tough questions. Do we value all workers? Do we value, do we not give people a pass because it's a cool industry? And do we actually demand that people invest in California as they're pulling out of California?
I want to add, Sonia, this is an incredible panel and an amazing conversation. And I love the term about reimagining California. And I want you to know that sometimes pop culture works. I got this text. Somebody texted me, Richie, from my comment on La Bamba. So it's good. I'm glad that people are participating. That was the takeaway. But I want to touch upon, I think the big gap that the pandemic has also shown is that we are incredibly short on nurses, on doctors. We already knew that, but now this is like even more so. And again, I'll bring it back with a personal story. My youngest sister is a senior at Cal State LA studying kinesiology. And I asked her, what's it like for your distance learning? What's it like right now to be a college student? And she said, you know, the laptop stuff is fine. Like I could do my coursework, but I am missing out on the lab work. When I graduate, how am I going to be able to really understand the human condition and the human body, which is what she's studying, when she's not able to right now physically do the lab that she needs to do? And I think that's a conversation that we need to have in terms of higher education and folks that are currently students like her, many across the state that are about to graduate who are not going to receive the training that they actually need. So that's one. Secondly, how do we reimagine education for our country and particularly for us, the state of California, to ensure that we are creating real pipelines for real jobs, real good jobs that pay incredibly well? Nurses, engineers, doctors, really like focusing on STEM to ensure that we are not in this situation again. And I think that the fact that if you come to school and you become a doctor in California and you graduate with hundreds of thousands of dollars in debt, you can't practice and you're constantly having to pay your student loans, it's going to determine where and if you are able to buy a home, where you practice. Do you stay in California? Do you leave? So we invest in a student's ability to become a doctor and then not invest in their ability to stay home. How do we invest in multicultural, multilingual health professionals that at the end of the day service this very community that we are talking about? Right now, I am in a conference room at Altamed, one of the largest providers, clinical providers in LA County and in Southern California. And I was here because we were doing an event providing Altamed, SEIU, and several other partners along with BISFIT 50,000 masks of PPE. And that's why I was late, so my apologies. But it's the showcase, I think, of there are examples that work already in place. So how do we maximize, to your point earlier, Controller, that we have the brain trust, we have the knowledge, we have systems that work. We're not starting anything from scratch. We just have to prioritize what it is that we want to do and how do we emphasize and focus that these are systems that have already proven true, and do that across the board.
And this is really important during a pandemic, right? You know, none of us have ever experienced something like this before. And the point here is that if anybody gets sick, they're going to infect other people. That is just the way this virus works. Yet not everybody has access to healthcare. My colleague David Hayes-Batista at UCLA just identified Latinos are twice as likely to lack health insurance than non-Latinos in the state. The state's plurality are Latinos. That's a problem for the entire state. About this medical access, People don't have access to a doctor in urban and rural communities, whether it's the Eastern Coachella Valley or it's Parlier, California. And then more than that, do they have a doctor that's linguistically or culturally competent? In California, there's 4 Asian languages and then Spanish that are underrepresented. That makes it really difficult to access care. We've already seen lots of studies over the last 2 years about Black mothers and their mortality rate because they're just not taken seriously. That's a lack of cultural competency. So we talked about internet as a social good. We talked about healthcare. We talked about childcare. We also know that we have a brain trust, and we're not new to a recession. We just suffered the devastating impacts, and California was hardest hit. We saw that money and responses went to wealthy corporations. We also know that certain racial ethnic groups were targeted by our financial institutions and subprime lending. Yet some of those very communities have helped the nation rebound in terms of home ownership gains. One of my last questions, and this is just rapid fire. How do you intend to do things differently? Differently than the recession, but also differently than the last 40 days of sheltering in place? What's top of mind to you? And we'll go ahead and go Dr. Rojas, Controller Yee, Assemblymember Gonzalez, and then Assemblymember Carrillo. Thanks.
So I've been thinking a lot about the role of philanthropy in this moment, right? The philanthropy represents less than 1% of the total money in our economy. So you guys are talking about trillions of dollars, and we will probably put out $45 million nationally. So I just want to like right size. One of the things is like I'm trying to right size where we are, because oftentimes I feel like charity supersedes public sector giving. And I really want to work in partnership with public sector leaders, because that's really where the impact is. So that's first, creating a tie between philanthropy and public sector. I think for us, our funding needs to be fast, and it needs to go to communities on the front lines of this crisis. So I'm really lucky to be stepping into a role where overwhelmingly, I think it's over 80% of our grant recipients organizations are led by people of color, in communities of color, in immigrant communities across the country. So being able to support them, frankly, just to keep the doors open in this moment. Like there's no, people need triage, you know, like you all, they went from one day to another, from working in an office to working in their home, and all of the things that come along with that. And then I think the third thing is making bolder bets, that it's not only our job to sort of triage or fill these gaps, as Controller Yee said, that the government has sort of let to hold bare. It's also to support organizing. I think it's incumbent on us as a philanthropy to support frontline organizing for those people who always knew that internet should be a public good, who always knew that healthcare should be free and available to everybody, who always knew that undocumented families needed to have access to the set of benefits and services that all of us have access to, because they clearly contribute to our economy, but they are also key parts of our democracy. And so I also think it's not the triage thing, that we can't fixate on the triage, that we're not going to fund enough anything to do to provide people with protective gear, but that what we should be doing is supporting those frontline organizations that are truly and have been working in their communities for a better, more inclusive America for all of us.
That's good. Thank you. And really, I so appreciate this period of time that we've been spending together. You know, I look at really my role, and personally, I will say I'm doing everything I can to stay connected. You know, I think we're the best policymakers, we're the best grant makers, we're the best thinkers when we are informed by the you know, the real experiences and you know, just the realities of what our communities are going through. And so I've been doing a lot of webinars, I've been sharing a lot of information, but more importantly, I've been doing a lot of listening. I'm gonna just close my remarks because I know there's a lot of calls for, you know, what can we do? And I just wanted to share an experience that I started since the pandemic. So I have a group of about 11 seniors that I check in with, who I check in with on a rotating daily basis. And it has really been so informative and instructive in terms of where the gaps are Obviously, within most of them are API, a lot of language issues, a lot of service provision issues, and a lot of isolation issues. And I think when I think about the most important call to answer, and that is just connect. Just stay connected and connect. But I want to end with a story because it speaks to something I'm very passionate about, and Assemblymember Carrillo and Lorena talked about this, and that is. We talk about our restaurants, our food service workers, our farm workers, and the issue of food, I think, is going to become a crisis issue at some point, and we have to be prepared for that. I mean, that's so basic for every household, so basic for each of us for sustenance, and yet I have the occasion to call a friend of my mother's who's been isolated. She's a widow, and just to share a little uplifting story. She says, here I am at 92 years old and I'm learning how to eat differently. Can you imagine that? But I have to say your mother was right when she told me when she first started having a salad, how she didn't like salads. And because they're cold, you don't cook them, they don't feel warm in your stomach, and then you end up with a bunch of water and you're going to the bathroom all the time. But that says something to me about a need for a 92-year-old and for a community of elders. And so I just hope that when we come out of this, that one of the things that we do prioritize is the fact that it's in recognition that we're all connected, that and this pandemic has taught us that we really are dependent upon each other. And so I hope our priorities can reflect that no one should be going without, and it's no longer, the world that we live in, hopefully politically, that, a segment of people can say, we've got ours and the rest of you are on your own. That's not the world we live in now, and I hope the pandemic has woken us up.
I think those are great, and I think one of the things that I've been thinking about a lot and thinking about how we move forward, and what I don't want to forget is some of the positives that have come out of this, and I'll give one. Our air quality in my district has improved incredibly, and that's not something small in a community. I have the not only the poorest coastal community in the state, but one that obviously has a working port, is affected by pollution, has high asthma rates. But with clean air also has come a lot of families walking at night and exercising, which is a good health benefit as well. It's also made me realize the lack of parks. I mean, we've talked about it and we deal with it, but when you're not supposed to get in your car and go somewhere and there's no parking lots open, you really start to worry about things like park deficits and the environmental justice issues that maybe we talk about, but we're seeing a little glimpse of what could be, I think, and that's exciting. And not to give in to an idea that we are going to face economic times like we've never faced before. That's true. We have a decision to make. Do we say we're going to preserve and protect those things that we have accomplished, whether it's workers' rights or environmental protections, advancements in healthcare availability? Are we going to protect that during these vulnerable times, or are we going to say it's just too expensive? I'm not willing. I think that I'm committed to saying I'm not willing to give up on my community during these tough times. In fact, I want to double down. If this pandemic hasn't taught us something, I've always been for universal health care, but like, my God, I mean, enough waiting. We've got to figure out a way that every single person in California is covered and has access. We got to figure out a way, and that's holistically. It's not just, can I go to the doctor? Is there a doctor? We got to do something about student debt when it comes to doctors and dentists, so that there are doctors and dentists who stay here. We've got to make sure that the system works for everybody. And I think the lessons we learn out of this aren't one that says, okay, we're just going to invest in corporations and let them get back on their feet so Wall Street gets back on their feet. No, we've got to do more than that. And I think that's what I hope to come out of this with.
I guess I'll end my comments by one saying thank you, Sonia, for convening this incredibly powerful group of women and women of color across the state. To just echo, and this is actually a study that you procured at UCLA on this last issue of Healthcare and Doctors. There are only 50 Latino doctors for every 100 Latino patients, and we are now, the Latino community is now the majority across the state, and I share that because just earlier today I shared a story that my grandmother was a nurse, and when she came to the United States, she was not able to practice because of language differences, licenses differences, and from the country of El Salvador coming to California, that wasn't available. So in my office, we're pushing a piece of legislation that'll actually look at what it would be to have international medical graduates, to be able to achieve all of the different cultural language issues, so that we actually have some kind of parity when it comes to healthcare. So I leave that as something that we are doing, and it makes me think about what our goals are. What is my goal as a legislator? What do I want to accomplish in the now 10 years that, God willing, I am able to serve? And I think a lot about what does it mean to have a Democratic Assembly majority, a Senate Democratic majority, and a Democratic governor. When the state of California is a Democratic state, where do our values fall? And I think that is a question that we will have to face as soon as we get back. And I'm looking at my colleague, because we know that there are some fights ahead. And so it brings to mind one of my favorite quotes from one of my favorite essayists and poets and activists, James Baldwin. And you can substitute for anything. And he wrote way back in the day, he wrote, "To be a Negro in this country and to be relatively conscious is to be in a state of rage almost all the time." I know that I have felt this many, many times, and I've tried to challenge that rage, that anger, that coraje that I feel for all of the injustices, and try to channel it in a way that at least I hope I can do some good while I can, and help as many people as we can while we can. And so for those of you that are watching, just know that there are some of us in this fight that really want to push, and sometimes we have to push our own Democratic colleagues to do what's right. And I know Assemblymember Gonzalez knows that very well in the fight that she had a few years ago that just is getting implemented with farm worker overtime, which seems so basic in our state, but yet was an incredible, huge fight. And I think we're going to see a lot of that as we move forward, as we deal with issues on the budget. I'm really glad that Controller Yee is talking about the API community, because I think that community is often ignored or not brought to surface when it comes to issues of immigration, when it comes on issues of employment and assistance. And there's the myth of the model minority, which is not a reality. And so I know in my community, I serve as an API Chinese American community in my district, that is hurting. Chinatown in my community is getting gentrified. Elders are being pushed out. And so these are real issues that we face every day. And I think that we have an incredible opportunity to reimagine, to start fresh, to stop with that's never been done before, which we hear a lot. That's never been done before. We can't do that. The lawyers say we can't do that. So no, I want to hear, if that's never been done, how can we do it? What's the answer to getting it done? And where do we need to organize to ensure that we push the political, and that the political will is there to get something done? Because we represent 40 million people across the state of California. And if the saying goes that where California goes, so does the nation, then we have an incredible opportunity right now to do what is right, to do what is just, to do what is necessary, by all means necessary, and ensure that we are securing a safety net for the most vulnerable in our community, and that no matter where you come from, what you look like, what language you speak, or what your legal status is, that the state of California is going to protect every Californian who calls this state home. And that, I think, is what drives me, and what I'm looking forward to doing as I continue to learn my job, and really just try to advocate the most that I possibly can.
This is wonderful. A super dynamic panel. I'm going to lift up Assemblymember Carrillo and bringing in James Baldwin, and this idea of righteous anger, not misguided, misplaced anger, but righteous anger. And some of the other ideas that were shared by all of you, that we need to take bolder bets, that we need to double down investments, that we need to preserve, protect, and I'm going to add expand rights, civil liberties, that there is an equality and a dignity of workers that needs to be lamented over and over again, and that the cognitive dissonance between those impacted the most and those able to shelter in place needs to be erased and addressed meaningfully. one of the reasons we did this is my favorite author, who I won't name, but I named my dog after him, talked about, the key to our salvation is women of color. These are women who loved themselves and loved each other when society said that they were nothing. So for all of you, thank you for spending this time. Thank you for leading in your own dynamic ways. Thank you for acknowledging your intersections, and thanks for centering the needs of vulnerable communities as the best investment, as the big bet, as the key to recovery. So I appreciate you. I appreciate our audience for having tremendous questions and engagement on this subject, and let's keep staying safe, and let's recover together and reimagine, as Dr. Rojas said, what life really can mean and what it can look like for our communities and our families. Thank you all.
Thank you.
Thank you, everyone.
Thanks, everyone.